Married individuals. For example, a study performed using 27,779 cases were more vulnerable to developing the advanced disease at the time of diagnosis than married. Single patients were less likely to be given medical treatment as compared to married patients. But marriage is responsible for a person's successful recovery. For those who are married tend to survive when their cancer therapy begins more than those who are separated. Prior to the advent of prostate cancer, scientists at the U of Miami studied 100 comparing survival rates amongst married, separated, and widowed. The 17-year span of this study, patients who remained married survived for an additional 69 months on average, followed by divorce and widowed patients, and researchers from UCLA and Harvard have identified similar survival benefits for married patients affected by bladder cancer. The association of data seems to have an impact on a host of conditions, and mental health is among them. Married individuals have a higher likelihood of satisfaction in retirement and a lower risk of depression than being married is linked better to improved cognitive ability. Blood sugar have a great. It's often said that married couples begin to resemble each other as they age. That may or may not be true, however. According to a 2009 study led by Italian researcher, couples share many of the same. In their expert analysis of 71 earlier studies, the researchers with Italian doctorates covered more than 100. The diversity of shared risk factors between spouses includes obesity, cholesterol, high blood pressure. These risk factors may be influenced by the couple's taste for each other, and also shared lifestyle. Australian doctors have noted achievement with a program that seeks to improve nutrition and physical activity habits in both partners. That is couples therapy. Being married looks to be advantageous for a wide variety of physical health outcomes. Mental health appears to be the most considerable. Among married, the risk of depression decreases markedly with age, and they are more likely to be satisfied with their lives when retired than their peers who are single. Being married has also been associated with greater cognitive health, a decreased danger of Alzheimer's disease, better blood sugar levels, and better outcomes for in the hospital are a few of the advantages of. Conversely, widowhood is linked with an elevated chance of sexually transmitted diseases among patients. Because women outlive, but spousal bereavement is more severe for men, and a study from California clearly indicates this. The researchers don't necessarily attribute the psychological consequences of bereavement to spousal loss as a whole, but rather consider particularly specific effect on the men. The surviving spouse's mortality was tracked over 14 to 23 years in a study published in the Journal of the American Medical Association. In the course of the study, 1,453 men and 3,294 women deaths by bereaved men and 15 deaths by bereaved women. A man's risk of death increased by 2.1 times that of a healthy man who lost a spouse during the study. For men with pre-existing health issues, the demise of a spouse brought about a 1.6-fold increase in the danger was greatest in the following period, but an elevated rate of death persisted for more than 2 years. As Shakespeare said, deadly grief. Research studies show that the death of a spouse increases the likelihood of illness and disability in the surviving spouse and that they turn out to be more vulnerable than women in this. The widower's health is generally poor because he struggles to maintain shape when living alone and his nutrition and other health habits suffer when his wife is in the hospital. Another factor is a study was conducted among 1,667 men in the Boston area which revealed that a drop in testosterone levels during the 10-year period of aging was the cause of the death of a spouse. Healthy marriages benefit you and your partner by safeguarding your health and safety, whereas unhealthy or broken ones are harmful to both of those targets. Why is that? The 3 probable reasons are biological, psychological, behavioral. Marital conflicts produce elevated levels of stress hormones. Marital stress, the release of cytokines, small proteins that set the inflammation is a recently discovered cardiovascular danger factor, and widowed and divorced have higher inflammatory marker levels than married men. The absence of behavioral health issues, they may be more inclined to engage in dangerous activities, like drinking excessively or smoking, but less likely. While married men and women tend to be more inclined to spend their time on wellness checkups and quality living, people who live alone tend to always be better. Elderly people living with an adult child don't get better care than other elderly people. Loneliness. depression, and social isolation also contribute mortality related to Harvard researchers discovered that lonely men have a higher risk of death from heart disease compared to and Boston's New England Research Institute discovered that 66% of men don't depend on anybody else for their primary social support, only 21% rely on other people, and 10 don't have any. For comparison, not remarrying after separation almost doubles a man's risk of isolation. Marry primarily for love, some for financial gain, and others for various Thus far, however, few had married for the purpose of health. Perhaps that will eventually change. Married men may add health and well-being to their criteria by collaborating with their wives. Sadly, not married men should concentrate on their relationship with their spouses in order to reduce anxiety. But instead of lining up for marriage for health, not married men should try to reach some of the advantages of a healthy lifestyle. They're missed. To choose wisely when it comes to basic health conditions, such as diet and exercise, in addition to other matters such as alcohol and drugs. You need to begin by seeing your doctor regularly, even while unmarried. Good physical health won't result in a deduction on your 1040 form, but they will improve your. Matthew, a cancer/stroke patient whose Ph.D. was obtained, asks you to help him raise awareness of health issues by sharing this valuable information. Please take the time to subscribe to and like this video.